The truth is a hard pill to swallow. America needs an overdose. Become truth's junkie. Use sorrow's tears to wash it down. Wolves in sheep's clothing unfolding lies. Truth! Set us free. Digging through the lies, finding you beneath the filth of hate and deceit. Truth! Bring us to our knees. Bent over in repentance, repeating the past, retreating. Don't ask, don't tell me no lies. Pop these pills of the truth is a hard pill to swallow. Coughing up these lies, choking my cognitive, distancing me from things unseen, confusing the very fibers of my being, my membranes, remembering, distorting my brain cells, brain dead to lies, brainwashed in truth, baptized in a new baptism. Is all forgiven? Repentance, recompense, making lies make sense, nonsense. Take this pill, pillow soften the blows of confusion, pillow talking life and death, eating the fruit of the seed you sown, reaping harvest unknown. Hello, everyone, and welcome to Change the Channel. I am Lisa L. Yeomans, your host, and I'm also the founder of Change Don't Come, which we are a voice in the fight for justice, a hand in building community, and a key to unlocking freedom. So again, thank you for joining me on this evening with my special guest, Dr. Latrice Rollins, and we're going to get more into a great conversation with her. But before we do that, I do ask that you would share the broadcast out, tag a friend, let someone know that we are on, and we're going to have a great conversation centered around fatherhood and our Black men in our community. So go ahead and share the broadcast out and tag someone in the broadcast. So Dr. Rollins, thank you for joining me on this evening, and welcome to Change the Channel.
Awesome. Thank you for having me, Sister Lisa. This is wonderful.
Thank you. So before we get started, I do want to let the people know who we are speaking with on tonight. So I'm going to read Dr. Rollins' bio for you all. So Dr. Latrice Rollins, a social worker, evaluator, educator, author, and change agent. Dr. Rollins is an assistant professor at Morehouse School of Medicine in the Department of Community Health and Preventive Medicine and Prevention Research Center. Dr. Rollins is also a Robert Wood Johnson culture of health leader seeking to build a culture of health and advance health equity for African American fathers. She is a fatherhood researcher with grants funded by HHS Office of Minority Health, the National Institute of Minority Health and Health Disparities, and the Robert Wood Johnson Foundation. She presents for global audiences on father engagement and provides father engagement training for practitioners in various sectors. She is the editor and one of many authors of the book Engaging and Working with African American Fathers, Strategies and Lessons Learned. Dr. Rollins worked for Georgia's Office of Child Support Services and the Georgia Fatherhood Program. Dr. Rollins also won national awards for her work as a program analyst for the U.S. Department of Health and Human Services Office of Inspector General, where she evaluated national programs that impact the most underserved populations. She was also an adjunct professor for social work at Indiana Wesleyan University and Simmons University. Dr. Rollins received a bachelor's of sociology from Spelman College and a master's and doctorate in social work from the University of Georgia. So again, Dr. Rollins, I do want to thank you for joining me. And again, welcome to Change the Channel. Also, I see we've had some viewers join. So thank you for joining. Thank you, Samantha, for joining
Thank
and
you, Sam.
sharing. And
Yes.
to the bio,
Friend.
Dr. Rollins is Samantha Wilson Walker's friend. Thank you for joining, Sam. So we're going to get into our conversations. And if you have any questions for Dr. Rollins, be sure to put those in the comment section below. So what I want to know, first of all, from you is what led you to the work of fatherhood?
Right. Yeah, that's always the first question. Why? Oh, wow. Yeah, I think that, at the core, at my core, I am for what's right. I don't like to see anyone mistreated.
Mm-hmm.
And when I worked for child support enforcement, I just saw a lot of disparities. I just saw differences in the ways that non-custodial or non-residential fathers were treated by our court systems, by other case agents, et cetera. And I was just, yeah, it just wasn't right, you know. And so I transitioned from there to working with the fatherhood program because what I said, you know, there needs to be more resources, there needs to be more services for fathers because when they were in the child support system, if they didn't have a job, it was like they really didn't have anywhere to send them at that time. This was back in like 2001, 2002. At that time, there weren't a whole lot of fatherhood programs, you know, and different services and resources around. So, you know, I was like, there needs to be something for them because if there's a non-residential mom or non-custodial mom, then there's this plethora of employment programs and parenting programs, all these things. And so, you know, so just from a professional aspect, I saw the gap, I saw the disparities, and then, you know, personally, just having so many men in my life, you know, including my father, including my husband, my uncles, cousins, you know, who are wonderful fathers, not perfect fathers, but deserve, you know, the same treatment, the same respect, same services as mothers would receive. So just, yeah, I don't know. You know, I feel like, you know, our pastor always says if something makes you angry, that's probably your passion. And so I would just get
Right.
so mad. I would just get so angry about the just, you know, it's just not fair, you know. And so I've just been able to really hone in on that gap and continue to work with others who, you know, see like me
Mhm.
that there's a need to be more inclusive of services for fathers, not only services but even just include them in research, include them in
Yeah.
policy, you know, a lot of different things. And so it has been so rewarding too, you know. I think that's why I, you know, kind of keep with it too, because I keep
Right.
meeting amazing people like you know, and other folks, and it's just like, yeah, I mean, this is something that needs to be done.
Yeah, and you know, and I'm glad that that is something that is being done. And I never really heard a whole lot about it until I actually came in contact with you and start doing some work with you because it is really one-sided when we're dealing with fathers and mothers, and especially in the system when you was speaking about the child support, you know, it's like and this is not to put the mothers down or the women down. This
Right,
is just the truth of the matter here. You
right,
know, everything really does lean toward mothers,
yeah.
you know, in, you know, as far as those things are concerned. So I'm just glad that this is there.
Hmm.
And just to be at the age that I am and just walking in learning about all of these things is kind of crazy. You know,
I
it's
mean,
a testament
it
to
just,
why this needs to be done, and like why it's just a great thing that you are doing the work
yeah,
because men they do need that attention too. So thank you so much for your service.
yeah. Thank
Thank
you
you.
for
And how
being
long did
here.
you say you've been doing that?
Oh wow. So let me see. Hmm. I started working with child support in 2001, right
Wow.
out of college, and so you know,
Mhm.
yeah, big ideas. Getting fresh out of college, I'm gonna change the world. Um, all the things, and so I did that, and I think I worked there probably until about 2005 or so,
Mhm.
and decided, yeah, I need to go back to school. I need to get some tools because everything that I'm doing here on the front line is basically impacted or driven by policy and research. And I'm only allowed to do so much, you know, here
Right.
in kind of one-on-one services. So I decided to get my education, you know, get
Mhm.
the tools and get all those letters behind my name to say I need to be at this table where we're making decisions about effective policies and programs for our families. So, so yeah, it has been at least 20 years
Wow.
of focusing exclusively on fathers. And I don't, you know, a lot of people are like, yeah, well, what can, you know, women kind of say about dads? Um, and I'm not really in the realm of educating fathers. My work is primarily around systems, around programs, around practitioners. So
Okay.
the trainings that I do are not to teach fathers how to be what like. I don't even come from that
Mm-hmm.
mindset or from that perspective that fathers need to be, told what to do or whatever, whatever. That's not. I look at fathers as assets and resources. So I really look at the practitioners that may be having some bias or having issues with or lack of awareness. Just
Mm-hmm.
like you said, you've been on the earth and had not known, the serious issues and challenges and barriers that fathers face. And so sometimes folks just don't know. And so I work a lot in that realm of enlightening folks about the importance, of engaging fathers, looking at their systems, looking at their practices, and just seeing, hey, did I ask anything about the father, of where he is? Maybe I need to start doing that. And maybe I need to look into connecting with some fatherhood programs or some other resources, to make sure that, he also can get served, So
Right.
that's kind of where my focus is, not so much on parenting program or anything like that.
Okay. So now I do have a question too. Have you found any challenges, being that you are a woman going into this particular type of work? Have you found any challenges or resistance in the work that you're doing?
Um, I mean, I think that's in anything that you
Mhm.
do. But yeah, there, like I said, people will say, like, what, as a woman, what can you tell me? Why do you care? Or what, I think a lot of times when we even put out flyers to say that we're speaking, on father engagement or whatever, and they see, my picture or whatever, they're kind of like automatically assuming that it may be a negative conversation,
Oh,
that we may be coming from the aspect of, fathers need to step up, fathers need to do more, something along those lines. And
mhm.
so when they get in the webinar or in the room, they're already kind of like ready for to defend themselves and realize, no, I got your back. I'm trying to help you out. So that kind of allays some doubts and fears and things like that. But I think the biggest resistance is not so much about me being a woman, but just being an advocate. Being
Right,
on the side of fathers, and it has historic and systemic
right.
roots in terms of fathers, men, black men, and particularly not being considered deserving,
Hmm.
of services or not being deserving of help. So, you kind of run up against that because the systems for so long have been set up to show, women and children are the ones that are deserving of all the help. Men need to just figure it out, they need to
Right.
get themselves together and figure it out. And it's just not the case.
Okay. That's good. Now, this kind of, I guess this is kind of
Yes,
like on the
Samantha.
same line. Have you had any pushback from women?
Yeah, yeah. But in fact, most of the comments, I'm not going to a father engagement seminar with a woman. What is she? Yeah, most of the comments do come
Wow.
from women. And like I said, because the health and human services professions are primarily women,
Hmm.
women who are in public health, women who are social workers, women who, work in all these different spaces, and my training is particularly for them. Oh yeah, I have had some very heated conversations,
Wow.
where they feel very strongly about, men that they've encountered, or
Hmm.
not even that they've encountered, just the idea, or just an assumption, and they don't want to let go of that. And so we have had some heated conversations at times. It's gotten better over time. I think
Right.
folks have gotten more open and accepting of, there's just a change in times. We are not back in the day where there were all these very traditional gender roles and, all of these things. It's very different now. And so I think people are more open and understanding. But every now and then you do get some folks that are like, what are we talking about men for? Why are you talking about that?
or let's talk about them and not
Yeah.
really about them for them.
Yeah, right. Exactly.
Yeah,
Exactly. Let's talk with them. Let's hear, yeah, what's
yeah,
their perspectives and how they're feeling about the services they receive or the lack thereof.
right,
Yeah, a lot of times folks, they don't want to hear about that.
right. So, one of the things you do talk about is the importance of father engagement. So, you can you just talk a little bit about that, the importance of that?
Yeah, and so that's kind of where I um, differentiate myself from the father involvement piece, because father involvement typically is around responsibility, access. So that's a lot of where the responsible fatherhood programs and all of those things are kind of based in that father involvement, increasing father involvement. Father engagement is more so on the side of the services and of the systems and policies. That's kind of where I see father engagement, making sure that practitioners are engaging fathers in services. They're
Mm,
including them. They are, finding out what their needs are and being responsive to their needs, unique needs that fathers have, as separate from what mothers may need, or it may be the same thing, but you just haven't asked,
right,
the
right.
question. So yeah, that's kind of how I differentiate father engagement versus involvement.
Okay. And I know, well, we've had these conversations, but that engagement piece could be like uh, uh parents taking their child to the hospital and they immediately go to the mother and they kind of leave the father off to the side and don't engage him in the conversation concerning the health of his child.
Hmm.
Yeah.
Absolutely. Absolutely. I just had a conversation maybe about a month ago with a dentist now. This is
Mhm.
another healthcare provider, but he and his wife were
Wow.
taking their child to the doctor. And the doctor literally like asked questions to the wife about him. What is his
Why are
name?
you sitting there?
And he's like, "Excuse me," like, "Hello, I'm right here," and so that's what I'm talking about, like
Right.
there's just this disregard, like even if he is right there,
Yeah.
it's like they just no. I feel more comfortable talking to the mom, or I don't know what the issue is. I don't know why that is just so common.
Yeah, that's bringing us to this question. Why do you think those things happen?
Yeah, I mean, so based off of the literature, a lot of the talk about, bias, talk about fear, talk about, just a stereotype that they may have,
Mhm.
particularly of Black men, and don't want to deal with it. If I don't know why they think he would respond aggressively to you asking what his name is, or getting his I don't know, but it really is something that needs to be addressed. We
Right,
have implicit bias training for providers. A lot of times it is around racial issues, but
right,
I always say it needs to also be around gender, because, when we look at, again,
right,
a lot of the services, it's Black men who are excluded. It's not just, Black all together, which there are absolutely, Black women, we see that in our maternal mortality rates and maternal
mhm,
morbidity, preventable deaths and all of those types of things. We absolutely need that. And we need to have that conversation about the implicit bias that affects Black fathers as well.
yeah, because it's not only even in the side of healthcare, also in schools.
Yes.
You're taking your child to school and you get questioned
Mhm.
when that's your child.
Oh, yeah, yeah.
So
I
it
mean,
happens
I've
all
seen that firsthand with my
the
husband. Yeah, they want to see his ID. Not now, because pandemic. Nobody is allowed.
time. Right,
Nobody is allowed up in there. But before, it was like, yeah, we need to see your ID. Who are you? What's going on? Which, okay, all right, fine. But again, whole thing is about equity. If you don't do it to me, then you shouldn't do it to him.
exactly, exactly. That's just sitting here thinking about it. That's kind of crazy.
I mean,
But
it's,
that
I mean,
happens
this is
with
in
fathers.
we're pretty stable. So My son and my daughter have gone to the same school,
Mhm.
elementary, middle, high. So you've seen us,
Right.
years, and it just, regardless, it's like, yeah, what's going on here now? What you need? What's going
Right.
on? What's the
Yeah.
problem?
Like, do you have to bring the birth certificate or,
Uh-huh. All the
that's the kind
things.
of stuff.
Produce some documentation because you must be here to do something. I don't know. But
Yeah.
yeah, they, like you said, there's a need for that level of sensitivity and inclusive environments in a number of spaces. And so,
Mhm.
yeah, it's not just healthcare, not just social services, but our schools and just a number of different spaces wherever you will encounter families
Right.
in community, there needs to be that level of equity.
Right. And I think just by just a level of awareness also, you
Mm-hmm.
know, on the part of the professionals that are talking to the fathers, whether that's in school or at some type of medical facility, just a level of awareness. These are
Mm-hmm.
like everyday things. Children do have fathers.
you
So
know,
we care about
imagine
them.
that.
We show
Like,
up.
yeah, I heard that statistic that 100% of children have fathers. I heard that.
Exactly.
Yeah, it's amazing, but we're working on it. We're
We
working.
yeah, okay, that's good. And this brings me kind of in the picture, I guess. Also,
Yeah.
families matter. So talk about Fathers Matter initiative. And
Yes.
how did you like how did all of this come about? You
Uh-huh.
know.
Yeah, absolutely. So this is actually came about through my work in collaboration with the Georgia
Mhm.
Department of Public Health in their maternal
Right.
and child health section. They have been doing a phenomenal job of leading a fatherhood initiative as one of their what they call a change management strategy that happened, I want to say 2019. When a lot of the Healthy Start programs that are particularly geared towards reducing infant mortality and now maternal mortality in selected counties, that they also engage fathers in that work. And
Mhm.
so, with that, the state, developed this, fatherhood initiative that they are going to lead. I've been a part of their Strong Fathers, Strong Families Coalition, Georgia Coalition, to really work together to think about, what are the things that we need to do to really make sure that fathers are engaged and are
Right.
included, particularly in maternal and child health services. And so they have been working very closely with the National Fatherhood Initiative to provide not only the fatherhood curriculum, but the 24/7 dad curriculum for the fatherhood programs. So training them on that, as well as administering what's called a father friendly checkup to their home visiting programs. And so the National Fatherhood Initiative has a model called a community mobilization approach. And that approach has been used in a number of different cities, including my hometown of Milwaukee, Wisconsin.
Mhm.
And it's an effort to bring together leaders from diverse sectors to talk about how they can support and promote father involvement. And in our case, we're saying father engagement.
Right.
So, with the work that I do in terms of community-based research and just being a very active partner with the Strong Fathers, Strong Families Coalition, they asked if I could lead that effort because it is a more you need a lead agency first of all to do the community mobilization approach, and it needs to be really community engaged. And
Right.
so I, of course, was like, oh, you haven't said another but a word. I want this, so
Yeah.
we started in January. We got trained by the National Fatherhood Initiative on the approach. We started working with partners about, okay, what's the type of data we need to collect? Who are the partners we need to have at the table? What's important? So we went through this whole phase of a community needs and assets assessment to find out what's already happening, particularly in our metro Atlanta area around fatherhood and father involvement.
Mhm.
And then we planned for a fatherhood leadership summit that would bring together leaders from media, from philanthropy, from health, education, uh, social services, just a number of different sectors and just different leaders to come together and brainstorm on ways that things that we need to do to really promote and support father involvement. And out of that conversation back in March of 2021, we
Mhm.
landed with 7 different strategies. I'm not going to remember them all right now. I might. Let me try. So we talked about one strategy, connecting fathers. And so that's connecting fathers to resources as well as connecting fathers to each other,
Right.
and something that needs to be done to promote and support father involvement. We had your area of addressing mass incarceration, because we know how impacted fathers are, not only by incarceration, that separation from their children, but also reentry, when they're coming back and needing to, re-engage, not only to get their basic needs met, but to re-engage with their children and with their
Right.
families. We have implementing father-friendly policies, because at the end of the day, we can train individuals, we can work with folks, we can put programs in place, but if there are not policies that really guide and provide some foundation for a lot of these things, it may go away. It may be kind of seen as a fad, or this
Right.
this this movement kind of died, So we really need some policies in place that ensure, for the long term, that we'll have these inclusive environments that are supportive.
Mhm.
Supporting inner healing, because we know, particularly in this pandemic, we've seen the rise in cases in terms of the need for mental health, particularly among our African American men, but for fathers in general, who men in general just a lot of times don't have those outlets to really express themselves and get the help that they need. So supporting inner healing is one. Reaching fathers, that's our opportunity to do some outreach, as it as it says.
Yeah.
Make sure that when we have all these different programs, I think you can attest to the number of folks that are engaged. It's like, I didn't know about that, I didn't know that people
Right.
were doing this and that. And so you can imagine a community member probably has no idea, what things are available to them. So the Reaching Fathers group is a way for us to think very creatively about how we can get this information to fathers about different resources that are available to them. Reclaiming the narrative. It started out as changing the narrative, but
Right.
um, one of the dads was like, no, we need to reclaim our narrative.
Right.
We need to get rid of these myths that dads are not, engaged, that fathers are, especially black fathers, are
Right.
absent and missing. We
Mhm.
need to reclaim our narrative and share our real stories. So that's that one, reclaiming the narrative. And then there's one more, improving relationships.
Okay.
Improving relationships with between co-parents, and
Mhm.
improving relationships between fathers and agencies. So, there have
Right.
been a number of, just conversations about that need for, fathers who are not living with their children, for those parents to get along and understand how to, communicate with each other, all those things. But then there's also, as we've been talking here about those systemic and provider bias, all those things that have been historic, that, at this point, a lot of fathers aren't even trying to look for help,
Right.
from some of these places. And so there needs to be, some trust rebuilt,
Mhm.
and all of those things, so that fathers can really access services that are available for them. So
Mhm.
so yeah, so this initiative, it started with that conversation, started with that summit, and we've been working together for almost a year now on what we're calling action plans, implementing different strategies to really address those 7 different areas. And so yeah, so it has been a journey, for
It
sure.
has, and we
Looking
are,
forward to more.
yeah, almost a year in, and
Mhm.
I've learned so much, and I'm so glad that I'm a part of the Fathers Matters initiative. And I
Yes,
think,
you voluntold.
yeah, yeah, I was volunteer. I think about that all the time. It's like she always telling me what to do.
You're not the only one.
I'm like, that's my big little sister. She's always volunteering me to do something.
You
But
got this.
that is so funny. But the fact, I think with programs like this, the Fathers Matter initiative, it's just important that people know that these things exist, that
Yeah.
people become aware that there are things going on in our community around these issues. And I think a lot of times, sometimes, especially within our community, because there's so much that we're dealing with within and without, so we're kind of fighting on both sides of the fence. And it's easy to look and say, well, this is not being done, or everybody is against everybody. But no, people are actually working within our community to build our community. And I think when we think about fatherhood and the Black men in our community, that this is a great organization, the Fathers Matters initiative, because for me, I'm just traditional like this. Men are our leaders, and I think once we strengthen our men, we are able to strengthen our community. And one of the things she was speaking about was resources. And I know when I first joined when we had our initial meeting, we were going to our breakout rooms and we would talk about different things. And one of the things that came up, especially when resources, and this comes back to engagement, fatherhood engagement. When I was dealing with my cycles of homelessness, and I would go to these homeless shelters, there were no men there. There was like literally no space for men and their families. So
Yeah.
now you're in this particular position. It doesn't really matter how you got there.
Right.
However, now your family is being torn apart. So that's just more weight, not just on the man, but also the wife, or his partner and their children,
Right.
because
Right.
there's such a divide there, because these resources are not there. So I think it's great within the initiative that that is one of the focus, is
Mm-hmm.
the area of resources and how to get men to the resources. And I know one of the things she was saying, that some men just don't ask anymore. Some men don't ask because it's already in their mind that these things are not there.
Mm,
These
yep.
things
Y'all
are
not
not
locking
there.
me up. That's all you're trying to do is when I
Exactly.
show up, you want to lock me up or to,
Right.
find something, like, no, I'm not going. No, you think I'm gonna go to child support fatherhood? No. Why? No.
Right.
So we have to so we have to build that,
Right.
trust again,
Mhm.
when there are truly, folks there with a heart to help fathers and offer these programs and services. We need to make sure that we're being honest and that we are, really, showing them dignity that they deserve,
Right.
respect, and just, yeah, that compassion that they need to get on
Mhm.
their feet, or just, do what they need to do to be successful in whatever it is they're trying to achieve. But that trust is that mistrust is historic, and
Yeah, absolutely.
we can't fault them for it, so we just have
Right,
to work on it.
right, absolutely. And being that we are speaking about, well, the whole conversation is about fathers, but I do want to want you to speak about your book, that you authored with several other women, engaging and working with African American fathers, strategies and lessons learned. And before you get into that, I do want to say I had an eye opener when I started hearing you talk about the book, and started hearing you talk about some statistics and different things concerning Black fathers, that they are the most engaged of any race of fathers. And this is why we need to become aware of these things, because like one of the sectors in the Fathers Matter initiative is reclaiming the narrative.
Yeah.
And that's the narrative that has been lost, buried under everything. So I just want you to talk, because I know that's in the book also. So just tell us a little bit about your book.
Sure. Yeah. So this is an effort to really address the education sector.
Mm-hmm.
Because as a social worker, I don't think I heard anything or read anything, learned anything about engaging fathers. We do
Right.
have kind of a generalist perspective in terms of working with communities and children and things like that, and families, but it's not very specific. And so
Mhm.
a lot of times folks get out into the field and don't really even know about, the importance of engaging fathers or how to do so, and don't expect to. They pretty much have been trained in case studies and scenarios around women and children. Fathers may show up if they're talking about substance abuse or they're talking about domestic violence. Then you may, read some, you know, case study about a father. But I really thought it was important for us to share unique instances where you should be looking for dads and may encounter them. So each chapter is authored by a practitioner and myself. Some of them not. Some of the authors they hit the ball out the park and they took it away. And but then some of the others I interviewed and got their perspectives and kind of the work that they do, and kind of I filled in with like the research part of it. But I really thought it was important to hear from practitioners, particularly other women, because again, like I said, the majority of our health and human services field is, female dominated, and so
Right.
a lot of times there is that myth that only men can engage men, and we have to hire a male to work with these fathers. And I'm like, we can't afford to wait. We can't afford
Right.
to wait to hire enough men to work in these programs. They need to be served now, and women need to be kind of equipped to do that. So each chapter is about a particular type of father that they may encounter in a particular program and service. And it allows for folks to read about a real father and his scenario, what was done to help him, and different lessons that were learned from that interaction. And so this started out as a part of my dissertation research, talking with other, particularly Black women who were working in fatherhood programs and learning from them. What were their engagement strategies? What were some of the challenges that they experienced as women working with fathers? And what were their lessons learned? And so
Right.
it just kind of built on that, and I just pulled some other folks in to those conversations, and we wrote a book.
Yeah, so people can pick your book up at your website,
Yeah.
and also on Amazon. Is that correct? Is
Oh
it on
yeah.
Amazon?
Anywhere that
Anywhere?
book is
Okay.
sold, you can kind of Google and get that. And I will, I guess, in the chat or something like that, share the promo code that we have up through March for you to get 20% off of the book.
Okay. Okay. So they can go there. And when you was speaking about some of these places like the hospitals and the medical field, and they're like women dominated, it kind of took me back to Samantha's questions. Why do you think these things happen? And that
Mhm.
could be, everybody, I'm not the expert here. This just could be a reason why some of these things are happening
Yeah.
when it
Yeah.
comes to father engagement, or
Uh-huh.
engaging fathers rather.
Oh yeah,
Right.
absolutely. I think that's why a lot of times the recommendation is, well, we need to hire more men,
Right.
to have that diverse kind of perspectives, and really to be able to acknowledge, oh, yeah, there are some men, because,
Hmm.
I don't know, we can, I guess, get just consumed with our situations and just feeling comfortable working with other women, or whatever the case.
Right.
And so we don't even ask, other questions. We identify, with mothers, or with other women, and we just leave it at that.
Right. Yeah, so that was a thought. So we're almost at our time, but before we go, I do want you to speak a little bit about the African American Child and Family Research Center.
Absolutely. Yes. So this was a dream come true.
Right.
And
Congratulations.
thank you. And it helps, to expand, the work that we're doing. And so it's a lot. It is research based. And so it's not that we will be delivering services or programs or anything like that, but the Administration for Children and Families, they run the TANF program, or Welfare Temporary Assistance for Needy Families. our early Head Start and Head Start programs, child care assistance, and they really want to know what are the experiences of African American children and families in those programs. What are their needs? What are their challenges with the programs? Things like that. There's so much to be explored here because of the history.
Right.
I tell people all the time, you think about TANF, you think about welfare, you think about the movie Claudine, you think
Oh,
about, just, that just like the feeling of, no compassion for your situation, a lot of, check in to see if you got any men and how all those kind of things,
right.
we kind of have that in the back of our mind when we think about African American families and the welfare system. We think about stereotypes, a welfare queen, all these different types of
Right.
things that have come out. So there's a lot of work to be done in terms of these programs and systems really addressing the needs of low resourced, African American communities and, the families and children that live in there. So we are tasked with doing research in those areas. We are tasked with doing this research with individuals who have lived experience. So not just, us saying this is what the problem is, but
Mhm.
really speaking with folks who are receiving benefits or not, but should be, all of those things to kind of get a good understanding of what's going on. So that we can set a nice, layout in terms of what needs to be addressed to really make sure that we can improve the well-being of African American children and families through informing policies and programs. It's that, and then it's also capacity building. So I spoke a few minutes ago about making sure that we diversify the workforce. That is not just female dominated. When we look at the research field, we look at faculty, we look at those that are even in place within the administration for children and families. It's primarily female, so
Mhm.
our capacity building program, one of the programs is to train African American male students who are in public health, public education, social work, and public administration. If they're in any of those majors, we want to work with them and expose them to this research, to these different fields, so that hopefully they will go into it, once
Right.
they graduate and contribute their experiences and knowledge to the field. And then we have, kind of our communication. So we'll be doing webinars, we'll be doing a conference. Hopefully, we will have our conference in April of this year, our first conference, and just be able to
Okay.
share what we're learning, not only just among researchers or just among the government funders, but we really want to share this information with the community and those that are impacted, particularly by these programs. So,
Okay.
fatherhood is, although it's not a I guess what they would specify as a priority. But I said, well, if it's the Child and Family Research Center, that it's going to have some fatherhood in it. So, uh, so we're also looking at the areas of fatherhood because a lot of times fathers are not. Um, Beneficiaries, of a lot of these services, even
Right.
if they are single fathers. And like you said, if they're, homeless and they
Mhm.
need, these different resources, a lot of times they don't get it. And so we need to address that as well. So that's what we are working on and just getting things started here now.
And I think that's awesome. I'm just so glad you're there because fathers will be included. But the fact that the mindset of someone is family and children, but the fathers are not included, like, you just can't make that make sense to anybody. You know, that
I
you
know.
would not include that you would think of a family without a father
Yeah.
included there. So, you
It's
know,
an interesting conversation. I
right.
think, and we certainly are open to, exploring because the
Mhm.
African American family isn't a, I guess, cookie cutter kind of model,
Mhm.
and it is not Eurocentric, it's not the nuclear, all the time. It's our families are composed of, cousins, uncles, like
Right.
our family, our grandparents, it's we our
Mm-hmm.
networks are very like village based,
Right.
and so it's different. And yeah, so we have to work on that. We're gonna work on that
Right. Right.
to
But that's
kind
a
of
good
show the
thing.
diversity and strengths of our families.
Exactly. Now you say you all are planning on having your event in April. Is that going to be a live event or is it going to be online?
Virtual, yeah, unfortunately, everything with Omicron and whatever other variant is going to come after that. We just have to do virtual.
Well, that works in my favor, virtual. I
Yeah,
may be
yeah, it does for a lot of people,
yes, so
so
let me
that's
know.
good.
I would like to join that, sit in on it. And
Absolutely.
okay, we are most definitely coming to a close. But before the question on the table, I do want you to talk about the event that you have or what you're putting together for my side of the story, the play. My side of the story, the Black Father Shares His Truth. So just give us some information and also if someone wants to be involved, how they
Yes.
want to go about doing that.
Yes, yes, yes. So this is also coming out of the Fathers Matter initiative.
Mhm.
Dr. Candy Dugas is a playwright, wonderful artist who has been connected to the Fathers Matter ATL initiative since the very beginning, and would love to hear and show father stories through a play or some visual performance. And so we're looking at a May date as of right now. We have to get that confirmed, but this will be an opportunity for us to really, again, reclaim the narrative, hear from real
Mhm.
fathers, hear their stories. And so she's looking for 3 to 5 fathers. She has 3 already, but if others are interested, you can definitely reach out to her. I think you were showing the information there. Just send your name, your email address, best phone number where she can reach you, and where you are in terms of your location, city, state, or whatever. But just reach out to her and see if we can get your story included in this narrative. So
Okay. And it looks like I'm frozen.
you're looking very, very pensive and
Yeah,
thoughtful.
like I don't know what's going on, but we're gonna keep it going. Maybe it'll start back, maybe it won't. Okay. So that's my side of the story. The Black Father Shares His Truth. And I'll be sure to keep posting that on my social media for you. And let
Awesome,
me see
thank you.
before we well, we're just going to get to our question on the table. But I do want to thank everybody for joining us on this evening. And if you have any questions for Dr. Rollins, you can put those in the comment section below. So, Dr. Rollins, I ask everybody a question on the table, and it centers around your work and what it is that you are doing within our community. So, when I thought about this question, I thought about fatherhood, and my mind went to neighborhood. So, if you had to build a neighborhood centered around, still your work, fatherhood, and Fathers Matter, and you had to build these houses, what would the houses represent? Say you had to build like 3 to 5 houses. Like if a father, they go in this particular house, they can get this out, this something they need, but it's all dealing with mental, spiritual, and emotional, something that's going to help them and build them in that way.
That's good. I usually don't like questions like this. It make me think
Really?
too much. But luckily, I've kind of done something like this before,
Okay.
kind of creating a neighborhood and then talking about the different,
Oh,
um,
wow.
yeah, talking about the different things. But I was thinking about challenges. So everywhere in any city, here are these buildings, and here are the challenges that a father
Mhm.
encounters at each building that he goes to. But I think if I had some, I guess, pillars or buildings that I wanted to erect around fatherhood, I think they would really be around values. I feel like services that definitely that there's the need for that, but I think if we just had like empathy, a building where folks could just understand and maybe, put themselves in their shoes and just see their perspective. They would be more open to hearing and meeting the need. I think if we had a building for, um, I want to say just like respect,
Oh,
um,
wow. Yeah.
you know, um, even if there are differences, um, just showing respect and respecting the position. I think you said, if you view fathers as leaders and as the head, households, things like that. I think showing them respect would be good. And then let me see what would be the last one. Um, I think we gotta love our fathers. So
Mm,
just I think love, like I say, covers all.
mhm.
So love is everything in terms of good, bad. We don't have to be perfect, but love. Be patient, be kind, all of those things. So I think those would be my three building/values:
Wow, that is okay. So you said empathy, respect, and love.
respect and love.
And while you was talking too, I was thinking like some type of healing. But when you said love, that includes healing also. I
Mm-hmm.
think that is so awesome. But just like imagine, because when I'm asking these questions, like I'm imagining that these things are actually happening. So just
Yeah.
like imagine if we, if something like that could be done.
Yes.
But and
We
then
would
when
be
we
so
think
better
about it
off.
too, yeah, even in your work, the Fathers Matter initiative, you working with the family for the children and family, that type of things. Those are things that you're actually bringing into that space.
Right.
So in a sense, it's like that. So I just want to thank you for joining me on this evening, and
Yeah.
I want to thank my audience for joining me, even though I'm still frozen over here. And my special guest tonight was Dr. Latrice Rollins of Morehouse School of Medicine and Latrice Rollins LLC. You can get in contact with Dr. Rollins at latriceRollinsLLC.com. She's also on social media on Facebook, Latrice Rollins LLC, IG.
Sometimes.
I'm sorry.
Sometimes I said sometimes I be on there.
Oh, sometimes on there. Latrice Rollins on IG and Twitter, Latrice_Rollins. Let me see. We may have another. Oh, thank you, Sam. Thank you for
Thank
so much for
you.
supporting. Thank you so much for supporting. And let me see here. The Fathers Matter ATL. That's on Twitter. Also Facebook. And you did mention it was on LinkedIn.
Yes, there's a group
And,
on LinkedIn for Fathers Matter.
and people can actually still join and become
Yeah,
be a part of this, right? Yeah.
please, please. Yeah, this is not a closed group. It's open. Anybody, we have people that not even in Georgia that are part of
Yeah.
Fathers Matter ATL because, they want to learn. They're passionate, about helping fathers as well. So
Hmm.
please, if you're interested, feel free to join in.
Hmm. So, and it's a great organization. It really has made me aware of a whole lot of things. Just made me aware of a whole lot of things. So,
Hmm.
I would say to anybody that's needing the information or just want to come be a part of the work, come in and just get the information. It'll give you a different outlook and a different perspective concerning fatherhood within the Black community. And we didn't talk about this, but you are part of the Black Female Fatherhood Scholars, and people can go to bffsn.com. Do you all have any events that are coming up?
Not yet. We usually have webinars and that are coming up, so I'll make sure that I post about those as they're coming. We do have a YouTube, so if folks want to look at the Black Female Fatherhood Scholars YouTube page, you can see our past webinars. But yes, that's another phenomenal group of women in fatherhood research, practitioners and researchers that are concerned about concerned about our dads in the community.
Yeah, and it's a great even the webinars or the lives that I've been on have been very informative. So if you haven't seen them, you can go over to their YouTube page and check those out. You'll get a lot of information out of that. So Dr. Rollins, I do want to thank you again for being my special guest on tonight. And for those that are watching, and those if you watch me live or by replay or you listen to the podcast, thank you so much for joining me. You can join me next Thursday at 7 o'clock p.m. Eastern Standard Time for another episode of Change the Channel. No static, no interference. Until the next time, everyone, goodbye and God bless.
Thank you.